Hey, Dr. C with you. Got a really good question recently, and this one came from Rebecca. Rebecca said, "Hi, Dr. C. I eat a really good diet and I have Hashimoto's thyroiditis. I want my thyroid to get better, and I hear a lot about certain nutrients being important for my thyroid. I'm not sure if I need them because I do eat good food, and I'm wondering which ones I should take." So that was basically it, but really good question, Rebecca, and I wanted to give you a good answer. So I thought this through, and in terms of documented evidence, how many nutrients are there that are important, and what are their roles, and do you need them if you're already on a good diet? Well, thinking all that through, there's 24 nutrients that came pretty relevant, that are ones that I wanted to share with you and make some sense out of. And for starters, I want to think about, if you're on a healthy diet, do they still help? And this is kind of funny. My views have evolved on this over the years. One perspective is that nutrients are only helpful if they're things that you're not getting enough of in your diet. And for sure, there's ample evidence in which nutrients help a lot when you're deficient. They can make up for deficiency disease. And I've been tempted to think that, if your diet is covering the bases, that they really have no roles to play. But there's a lot of examples in cases of thyroid disease where it's almost like nutrients and diet are separate domains. We'll talk about all these things individually, but one example would be selenium. We have evidence how being deficient in dietary selenium makes things worse. And then we have data on people who are fine on selenium where supplementation still can have some benefits. And then there's also the thought about excesses being harmful. And that's true for all nutrients. Some have narrower ranges than others. But it seems that yes, there are times where nutrients help because they make up for dietary deficiencies, and there's other times in which nutrients help for ways that might not even relate to exactly what they do in the diet. We talk about that as the physiologic or the nutritional versus the pharmacologic or the almost drug-like effects that nutrients can have. So they can be useful even if you are getting enough in some contexts. So in thinking about these, the idea, I'm going to talk about a lot of ones individually, but nutrients work collectively. So the extent to which you're struggling with chronic symptoms, with unstable thyroid levels, fatigue that won't go away, poor tolerance of exercise, weight issues, skin, hair, nails, digestion, things along those lines, you really want a global improvement in all things that relate to your thyroid. So that means you want less inflammation, less of an immune attack against your thyroid, better ability for your gland to synthesize hormone, better ability for your gland to clear free radicals, better epigenetic responses to your body's thyroid hormones, better release of all types of those hormones, better breakdown and conversion and optimal ratios of those hormones, and better elimination of them when your body's all finished with those. So all things that are critical. And some nutrients have roles on more than one of those steps. Some we know have strong steps on a few of those steps, but collectively, those are all things that are critical. So also a thing to preface this with is thinking about, why can't you just test? It would make a lot of sense to just do a test and take the nutrients you need, or test and see if there's ones that you need more of than someone else, and then take enough to make sense of that. And that's also an idea that appeals to me in a theoretical sense. I love that idea. But in terms of logistics, nutrient testing, it's just failed to live up to the expectation. So it turns out that it's not that easy to measure nutrients in real time, and also it's not that predictive of who would benefit in cases like this. There are bad enough deficiency states to where you can see nutrient deficiencies on almost any test available. The most basic, simple test with the most crude reference ranges will show up when someone's horribly deficient past some point. But again, we're not even talking about identifying deficiency states. We're talking about benefits the nutrients have that are somewhat independent of your dietary intake or your absorption. So in those cases, testing is not helpful. And then plus, testing is just horribly inaccurate. There's a couple of big exceptions like iron, vitamin D, and possibly some of the trace minerals. I'll talk about those. But by and large, as appealing as the idea sounds, it's not really worthwhile because it doesn't predict who would or would not benefit from nutrients. And it also doesn't actually predict how much you would need of those nutrients. That's also counterintuitive, but with the exceptions of iron and vitamin D, it's not useful. So something I would not pursue and wouldn't invest in highly. And I've seen so many tests. There's ones that use white blood cell uptake of nutrients. There's those that measure serum levels, that urinary metabolites, urinary amino acids, urinary organic acids, you name it. There's a lot of ways to look at this. And frankly, none of them are practical and none are repeatable. By repeatable, I just mean that if you did the test twice, you had your blood drawn twice, or just 2 samples done the same day, you wouldn't get the same results. It's a coin toss as to which one was yours and which one wasn't. They wouldn't be identical. So that's the reason I don't really use those. A couple of quick ones that are close. So things like folate and B12, they are measurable and they can be worth measuring. They do show up in terms of serum tests when they're low. That doesn't mean that if you're normal, that they're not things that could be useful for you or that they couldn't be optimized. Also, we think about some minerals. So I do think about those that have had resistant osteoporosis. There are red blood cell tests of minerals like magnesium, calcium, selenium, others. In some of those cases, you can help ferret out a mineral that might be lacking where you wouldn't expect that otherwise. Vitamin D, iron, definitely critical and needing a lot of individualization. B vitamins, there are serum tests for those. And yeah, if someone's horribly deficient in a way that doesn't really happen that much, that can show up. And then finally, zinc. Zinc is one to where if someone is malabsorbing a lot of nutrients in general, if they're consistently low in iron, vitamin D, B12, and they don't seem to come up very well, it can be worth checking for serum zinc. It's not the most perfect indicator, but it can show up if someone has unusual losses or if it's hard to absorb for them. All right, so buckle up. We got a list of nutrients to go through. There's actually 24. There's 24 things that are important and documented to be relevant for thyroid function through supplementation. Number 1 of 24, vitamin A. So this one is important because it seems to help regulate the genes that control to how your body responds to TSH. And then there's also thought about how some with thyroid disease may have a hard time genetically converting beta carotene into vitamin A. That last point, I'm not that concerned about. I've run the math on that. And by and large, even though the conversion can be poorer, you can easily consume enough beta carotene to where that's not really relevant. You've got enough to start with where you'll still end up with enough in terms of not being dietarily deficient. But in terms of evidence of benefit of supplementation, there was one study that looked at 84 women, a pretty broad range of adult ages. They got vitamin A or placebo. And there was women of different body weights that were looked at. And what they saw was that vitamin A supplementation to a reasonable amount had a clear improvement for thyroid function. So we saw about a full point change in TSH and even more for free hormones, free and active hormones. So big difference through supplementation. And these weren't those that were overtly deficient. In terms of amounts and types, so I really like a combination of mixed carotenoids and also active vitamin A, which is called palmitate. And quantities, we think about roughly 300 to 350 retinoic acid equivalents. That's about a third of the RDA, and that's consistent with what would work well on top of a healthy diet and give results like would be given in the study that I just cited. That's also an amount that is safe. Vitamin A is fat soluble. Higher amounts of it can be harmful to your liver when it's taken in very high dosages, and it can also be associated with birth defects. So some is good, more is not better. And that's a recurrent theme you'll hear a lot of. Okay, next up, vitamin C. So it turns out vitamin C can protect against the damage to thyroid cells that can occur with autoimmune disease. It also makes a difference for helping selenium work better to regulate iodine levels. So we've seen this help in terms of clinical trials, especially with the absorption of thyroid medication. Some people have a hard time consistently absorbing the active ingredients, and they can have really erratic blood levels. So one study showed that 31 people on treatment had blood levels improve by almost 70% difference just by taking a little vitamin C. And vitamin C, perhaps, boy, as much as, if not more than many nutrients, it's getting right amounts. So when you get massive amounts, you actually shut down your glutathione. You shut down your NRF2, your own antioxidants. So too little is bad, way too much is bad, but there's a sweet spot. And those with thyroid disease, that sweet spot seems to be about 400 to 500 milligrams per day. So not a whopping amount, but some. That's really useful. Vitamin D. Lots and lots of data on this. I've written about this one all by itself in great detail. We know that vitamin D affects the risk and the disease progression for Hashimoto's, for Graves' disease, and for thyroid cancer. We've got pretty good evidence that vitamin D, to the extent that it optimizes blood levels, can benefit thyroid antibodies. Now, I talked about the blood levels because this is important. Vitamin D has a rather narrow range of ideal effects. And those effects can be for immune response in general, as well as to your thyroid, and longevity and disease risk. And the sweet spot comes about at blood levels of about 30 to 50 nanograms per mil. It's not a huge amount. Many adults do fine with about 2,000 IUs per day. That's what I encourage for baseline amounts. You can check your blood levels, and if that does not bring you up to that target, you can add a bit on top of that. People need more if they're heavier, if they live further north of the equator, if they have darker skin, if they're less outdoors as often. But yeah, you may need different amounts, but you rarely need less than about 2,000 units, and D3 is the preferred form. Okay, vitamin E next up. So this is important because this also has roles to play with preventing free radical damage to the thyroid cells, like vitamin C does. So the thyroid cells convert iodide into iodine. I'm exaggerating that because the difference is subtle. And iodine is a hot potato. It's just spewing free radicals everywhere. And your thyroid needs vitamin E to prevent against that from being harmful. So we've seen that memory loss can be a consequence of thyroid disease. And from some pretty good animal studies, vitamin E supplementation has been shown to improve cognitive function during states of hypothyroidism. And this is, again, this whole talk is about ways in which these things help, independent of just, do you need it in your food and are you deficient in that? So yeah, we've seen that vitamin E supplementation can lower any impairment of memory that occurs from being hypothyroid. So positive thing. In terms of types and amounts of supplementation, I think about roughly 25 milligrams as being a good dose. That's consistent with clinical trials. And vitamin E is one of many nutrients that comes in a spectrum. So it's not a thing, it's a category. We'll talk about the vitamin K complex, the vitamin B complex. Many of these exist in a spectrum, and vitamin E is no different. So you really want to get delta and gamma tocotrienols and vitamin E isomers. The older versions of vitamin E were simply D-alpha tocopherol by itself, or the synthetic DL-alpha tocopherol. And those are just less effective than the spectrum of tocopherols and tocotrienols that we see now in the clinical trials. After vitamin E, let's think about vitamin K. We're doing the fat-soluble vitamins first. So vitamin K is critical for the blood supply to your thyroid and then your bone health. And we've seen from clinical trials that people with thyroid disease have higher risks for peripheral vascular disease, so such as blood clots or strokes or cardiovascular disease or aneurysms. And we've seen clinical studies showing that vitamin K in a full spectrum can lower those diseases more than a placebo can. So it's clearly an effect. And this is an effective supplementation as well. We also know that those with abnormal thyroid hormones, either too much or too little, have a higher rate of bone thinning and also hip fracture. So we could use more data, but so far the human studies we have suggest that supplemental vitamin K may lower that risk of bone loss and improve bone repair. So again, this is a spectrum. There's a lot of kinds of that. We think about menaquinone and phytodiones, and there's different subtypes as well. And of these, we consider them to be K1, K2, and then various MKs, MK5, MK7, and you want a full spectrum of these K derivatives. And in terms of amounts, the data suggests that those with thyroid disease will do best between about 300 to 500 micrograms per day. All right, so that's the fat soluble. Now we'll hit the water soluble and the B vitamins. So first up is B1 or thiamine. This is one, like many B vitamins, that plays roles in forming energy from carbohydrate. There has been some papers suggesting that thiamine may play a special role in fatigue secondary to thyroid disease. And this is one we don't store very much of. In the study, treatments were shown to resolve fatigue in those who had Hashimoto's disease. And they were seeing results pretty quickly, a matter of hours or days. Now, this was a study in which thiamine was given orally and also in intramuscular injection. And when the results were showing up that quickly, it would be nice to see a follow-up with a placebo group to see if there were placebo effects with this. And so far, the study has not been replicated, but it did create a lot of excitement about it being relevant for fatigue. Now, with B vitamins, with this complex thing, this group thing, if you've got super high amounts of one or some of them, you actually block the effects of others. So I'm not a fan of these massive, thousands of times of the recommended daily intake of B vitamins. We would never consume those things in nature, and there's no valid argument about us not absorbing them. And there's also no valid argument about us losing B vitamins to a degree to where we would need doses that high. Many who have looked at this phenomena of mega dose B vitamins, and they've argued that it's mostly a function of the psychology of supplement formulation. And what I mean by that is, it looks like you're getting a whole lot of stuff on the label. And in the modern world, we're consumers. The more we get, the better bargains we feel that we're getting. And yet they're totally cheap raw materials. So it costs nothing to put in 3, 4, 5,000 times the RDI of thiamine. It's just dirt cheap. But is it helpful? Again, our bodies would never be exposed to that much, and we don't malabsorb it. We don't lose it in whopping amounts. So the idea that more of it is helpful is not based upon good evidence. And there's more mounting evidence that those with thyroid disease are better not to have huge amounts of these B vitamins. So thiamine, I encourage roughly 2.4 milligrams. It's about twice your daily requirements. That's plenty. That's quite useful. Next up would be riboflavin, so B2. So we have seen data showing that riboflavin deficiencies can mimic a lot of the symptoms of hypothyroidism. We've also seen that thyroid disease can make riboflavin harder to absorb. So a new development is that we know that riboflavin has to be activated. I like riboflavin 5-phosphatase because this is a version that doesn't need to be activated. That step is already taken care of. Those that have abnormal thyroid levels, they can't activate riboflavin that well. So it's nice to have it in a pre-converted form. The amounts that are best, 4 milligrams per day is consistent with studies for humans with adult thyroid disease. That's about 300% of the daily value, not 3,000 or 5,000 or 8,000. Next up is B3 or niacin. Now this one, like other B vitamins, is critical because it's also needed for forming energy out of carbohydrate and fat. People with thyroid disease may have a hard time doing this because a lot of that energy is trapped as fat inside their livers. So we've seen that niacin supplementation can help by lowering thyroid binding globulin. And people that have fluctuations in their estrogen levels, they may have a lot of thyroid binding globulin that's keeping them from making use of their thyroid hormone. So that's where niacin can be useful. Now, niacin comes in different types. The delayed release, the slow release, the time release, they're not a good thing. There's a lot of data saying they can slow your thyroid. They can actually cause hypothyroidism. So you do want immediate release forms of niacin, but definitely not in massive amounts. It causes flushing. There is a version called inositol hexanicotinate, which doesn't cause flushing, but it also can be an issue for slowing thyroid function. So plain niacin is preferable, niacin, niacinamide, and not a whopping dose. 60 milligrams or about 375% of the daily intake, great plenty. You don't need massive amounts above that. There's even data showing that the high amounts can cause a thing called niacin maculopathy, which is permanent visual loss from B vitamin overdose. So it can occur. Next up, we've got B6. So this is important for thyroid function because many who have thyroid disease have a hard time converting this one as well. This one has to be converted to pyridoxal 5-phosphate, and that can be a step that's difficult. So B6, when it's not converted, can worsen iron deficiency anemias and also make it harder for people to have their blood get better with iron supplementation. We've seen that B6 supplementation can help those with thyroid disease recover better from anemias. So types or amounts, again, you want pyridoxal 5-phosphate. That's the safer amount that's pre-converted. Regular B6 can become neurotoxic rather easily. So that's a drawback about plain pyridoxine hydrochloride. It's also a drawback about high doses of it. I consider 6 milligrams, or about 400% of the RDA, a good dose of pyridoxal 5-phosphate. Quick note, we went from niacin, aka B4, straight to B6. We skipped B5. So B5 is pantothenate. There's not hard evidence that it's a critical thing for thyroid function. There are certainly useful things that it does in the body, but no data about many being deficient in that, and no human studies about pantothenate acid and thyroid function. So that's what we're talking about. Are there human studies, are there outcome studies showing that supplementation with this actually makes a difference in thyroid function, even in those who are not deficient? That's what I'm focusing on solely here. Okay, next up we've got folate. This is one to where it's very relevant. The genes that are involved with utilizing folic acid are ones that are almost always abnormal, or I should say just variant in those with thyroid disease. So the drawback is that with variant MTHFR genes, one cannot utilize synthetic folic acid effectively. And they've shown that synthetic folic acid in B vitamins or in the dietary sources has been shown to suppress the secretion of T4 and T3. And it may also be a risk factor for the development of colorectal cancer. And we see this in a huge variety of processed foods. This might be one of many ways why processed grain products are problematic for people. Not only do they often have too much iodine, they've got synthetic folic acid, so one more reason to avoid them. And you do want to avoid it in supplements as well. Whenever you see folic acid in a supplement, just don't take that. Folate is different, but you don't need huge amounts. I like versions of folate that your liver doesn't have to convert. There's one called quatropolic that I think has the most studies on to date for thyroid disease, and it already is in a form of methyl tetrahydrofolate, so it requires no activation. And I recommend to get between about 600 to 700 micrograms, roughly 170% of the RDA for those that have thyroid disease. Next up, we've got B12. This is a big one for thyroid function. As many as 40% of those with thyroid disease can be low in B12. And those can be symptoms that can be things like weakness, poor memory, and depression. They can be things that make you think you're hypothyroid, even if you're not. And we've got good evidence showing that those who are given B12, they generally see those symptoms clear up in several months. There have been studies showing that those that have similar symptoms, they improve even if they're not measurably low in B12. So it can be good for those types of symptoms. There's now versions of B12 that are very bioavailable orally. The main one there is methylcobalamin. Many studies have shown that it's basically as effective as B12 shots. It works just as well. The amber red liquid of a B12 shot going in is a powerful placebo effect. It certainly seems like something has to happen. And red things are always more energizing as placebos, whereas blue things are more sedating. So there's a powerful effect from that, but honestly, oral methylcobalamin works even for those with poor digestive function. I would encourage adults with thyroid disease to get 200 micrograms of that daily, and that is because of the difficulties with absorption. So once you factor in the fact that much does not absorb, the amount of 200 micrograms ends up being a reasonable daily dose. So this is one B vitamin to where 8,000% of the RDI is not unreasonable because it's poorly absorbed. Next up, we've got biotin. And biotin is one to where we do see connections between thyroid disease and it. One paper showed that as many as 38% of women who had hair loss, they can be low in biotin. And the pitfall here is that biotin can safely reverse biotin deficiency, and it can be safe, but too much biotin can slow thyroid function. Now, even normal amounts of biotin can make thyroid blood tests abnormal. So there's two different things. So a huge dose of biotin, like 5, 10, 15,000 micrograms, can actually slow your thyroid. But even a reasonable dose of biotin can make your thyroid blood tests look abnormal. So yeah, so two separate considerations there. Any pills that contain biotin or probiotics, you want to avoid for at least 3 days before having your thyroid tested. Super critical. As far as amounts, 100 micrograms per day is threefold, 333% the RDA, and that's a good dose for those with thyroid disease. I wouldn't go beyond that. Okay, out of the B vitamins, let's go on to calcium. And this is one to where lots of relevant factors like vitamin K and vitamin D because of bone health. So people with thyroid disease, they have greater risks for hip fracture and also for bone thinning. And we have to think about dairy foods as well, because they're generally avoided for those with thyroid disease because they are so high in iodine. So if you're avoiding dairy foods, your calcium food intake does become important. Thankfully, there's a lot of data now showing that calcium, as found from plants, is much, much better absorbed and more efficiently used by the body. So you don't need the whopping amounts of milligrams. My favorite is one called dicalcium malate. It's a plant-derived soluble form of calcium. And really, 300, 350 milligrams is great plenty to assure good bone health. More is not better. And yeah, very good thing. There's a lot of insoluble versions of calcium supplements like calcium carbonate, oyster shell calcium, bone-derived calcium, egg shell-derived calcium, also algae or coral-derived calcium. Those are all things that are insoluble. Think about putting an eggshell in a cup of water. It's going to sit there until you take it out. It won't dissolve, right? So calcium that won't dissolve, or like a chunk of bone, calcium that won't dissolve will end up in the wrong place in your body. It won't go to your bones. It might make calcified plaque in your heart. It might make bone calcifications. It might make joint remineralization. So we can see negative things happen from that. But some good soluble calcium is helpful. And then akin to calcium, we think a lot about magnesium too. And this is a highly studied nutrient that many can get low in. So we've seen studies showing that magnesium supplementation can help lower thyroid antibodies, both antithyroid globulin and antithyroid peroxidase. In a clinical trial, it was shown that people with long-standing structural thyroid disease, that magnesium supplementation improved the structure of their thyroids over a few months. So good thing to include. Now, a big pitfall with magnesium supplements is that, well, it's a really effective laxative. That's what this means. It's going to shoot right through you if you take too much. But like calcium, there are better soluble plant-derived forms that are less of a problem that way. So I also like a dimagnesium malate the same way I like dicalcium malate. It's one that gets into your bloodstream, doesn't irritate the intestinal tract as readily, but can be effective for helping all the various things that magnesium does in your body. Because of bowel tolerance issues, somewhere around 70% of the RDI is a good upper limit for daily supplementation. That's about 300 milligrams. You should also be getting that from your diet. And leafy greens, nuts and seeds, beans, legumes, they're rich sources of that. But an extra 300 milligrams can be a great way to assure much of your biochemistry will work better. All right, next up we got is zinc. Now, zinc is important for the production of thyroid hormones, also for their absorption and use by the cells, and their activation, both T4 to T3 and also T2 to T1. We do see that low zinc can impair thyroid function, and then also vice versa. Low thyroid function can lead to zinc deficiencies by changing zinc absorption. There was a pretty good double-blind placebo-controlled study showing that women who had weight struggles and thyroid disease could supplement with zinc and see better T3 and T4 levels, even though their zinc didn't change. So this is back to my point about testing not always being helpful. These weren't women who were zinc deficient, and their zinc blood levels didn't change by supplementation, but their thyroid hormone levels did. So those who have had weight struggles, zinc can be a good way to help your body make better use of your thyroid hormones. All right, next up we've got selenium. This is one that I've done a deep dive into also, and we could spend a lot of time talking about this and thyroid function. The Cliff's Notes are, you want to supplement with it and you want it in your diet. So eat 2 to 4 Brazil nuts per day and supplement with it. In terms of amounts, 100 micrograms is a nice amount on top of a good dietary intake. That's about 182% of the daily value, but we've had multiple human studies showing that selenium supplementation, it improves how your thyroid is working, and also it can lower the autoimmune response. Now, it might take as much as 3 to 12 months to see a clear decrease, but over time, it's consistently helpful in those ways, and really no big drawbacks. The other big thing about selenium is it makes your body more tolerant of a broad range of iodine. So you're less apt to have the harm of excess iodine when you're sufficient on your selenium. So tag in that 100 micrograms per day. All right, moving along with minerals, copper. Copper is also known to be important to thyroid function. It's a critical part of the enzyme superoxide dismutase, and that's one of those internal enzymes. So one study showed that the amount of copper in your blood correlates pretty directly with the amount of active hormones coming out of your thyroid. Copper supplements are well absorbed. They do make a difference for low copper states. And ideal amounts, we don't need much, but you want some. So roughly 1 milligram per day, which is pretty much the daily requirement. And bisglycinate, that's one I like a lot for trace minerals. That's a compound that's based on a gentle, well-absorbed amino acid chelate. So bisglycinate forms of minerals are non-irritants, and they're ones your body can do a good job regulating and taking in when you need it and not absorbing when you don't. Okay, next up for minerals will be manganese. So manganese is an essential part of the enzyme 5'-deiodinase type 1, and that's a big part of activating your thyroid hormones. It turns out that on the other hand, if you're consuming manganese from toxic sources, like from industrial wastes, more than about 20 milligrams a day can hurt your thyroid and slow it. So we've also got this whole U-shaped curve. Manganese, we don't see deficiencies common, but also the bisglycinate chelate is a good form of that. A milligram a day is great. That's about 43% of the daily value. We do get that in many foods, but that little bit can be a useful adjunct. Next mineral would be chromium. So chromium, we've learned about as being relevant to blood sugar regulation. And we know that there's a big overlap between thyroid disease and diabetes, prediabetes, or hypoglycemia. We've had many good clinical trials showing that chromium supplementation makes a difference for those conditions, and it cuts the risk of those diseases to progress. This is one we don't need high amounts of, about 200 micrograms, which is about 5-fold the RDI. And yes, I do like the glycinate chelate for chromium as well. Molybdenum is a mineral you don't hear about a lot, but you should. There's quite a bit of data showing that this one has direct connections with our T4, T3, and free T4, free T3, and total T3 levels. It absorbs pretty well from supplements, and about 80–90% of it gets into our bloodstream. Also, glycinate chelate forms are best. Those with thyroid disease do well with a tiny amount, about 100 micrograms, or about twice the recommended dietary intake. So now, those are vitamins, minerals. I want to talk about some essential fats, and we'll talk then about some things that can help your body's thyroid regulation. So essential fats, there's 2 fats that we need that we cannot make ourselves, and that's alpha-linolenic acid and linoleic acid, or omega-3 and omega-6. Now, alpha-linolenic, that's a vegetable omega-3 fat, and when we have that, our bodies convert that to the more active EPA and DHA, eicosapentaenoic or docosahexaenoic acid, and those are ones that manage and lower inflammation. Now, people are different in how well they convert alpha-linolenic into EPA and DHA. So it is good to supplement with straight EPA and DHA because they don't need that conversion to occur. One study showed that adults with thyroid disease, one of the strongest predictors of that disease progression was being too low in active omega-3 fats. We've seen evidence that supplementing with omega-3 fats can lower inflammation and also lower pain in arthritic autoimmune diseases. In the normal doses that are used, these are well tolerated and no big drawbacks. Now, a big caveat about omega-3 supplementation, you want to know they are assayed for their iodine content. Fish oil supplements can have unsafe levels of iodine if they have a lot of crude fish products with them, but some of the molecularly distilled forms do not have really any measurable iodine. But you can't assume that. So ask for assays for iodine. We assay our fish oil products. We're confident in their iodine content and that it is negligible. You should be under 10 micrograms of iodine per serving of fish oil for it to be safe. So that's super critical. Adults with thyroid disease, the recommendation is to have 1,000 milligrams of EPA and 500 milligrams of DHA in their supplementation. There's also linoleic acid, and that is omega-6 fat. This is one that it's been badly misaligned, but it is one that is essential. However, it's rather unusual to be deficient in that. So don't be frightened of using omega-6 fats in cooking, nuts and seeds. They're good foods. That can be a point that can be counterintuitive for some, but please Google my name and omega-6 fat. I've written crazy deep dives on it, and good thing, we don't need to supplement with it. We also don't need to be afraid of it. Okay, so those are nutrients that our bodies can't make, but the whole point of this discussion was not so much how do you treat a deficiency or what do you take if you're low in something, but it's that no, these are things that have been shown to help your thyroid. So along those lines, here's a few bonus items. Now, a lot of how your thyroid works is what happens after the fact. So what I mean by that is there's before the fact, which is your brain asking your thyroid to work. There's your thyroid putting out the hormones. And then the after the fact is how those hormones move through your body, how well you make use of them, how well you convert them. Do you get rid of them at the right time? Do you get the right ratios between all the various hormones? And those things are all functions of a group of enzymes called deiodinase. These convert T4 to T3, T3 to T2. They'll also make T4 into reverse T3, which is a normal byproduct, and they get rid of the hormones when they're all done. Now, your body's got to have enough T4 and T3 to work with, but once it does, then these enzymes are part of what really makes this work in the tissues, kind of like local government, so to speak. So there's one called D1, which is mostly active in the liver and the kidneys and the thyroid itself. We've got D2 in the brain and the muscle, D3 in the brain and also in fetal tissues. And yeah, these are converting the enzymes. They can be blocked by various things. There's a table I've made about this, and they're active in some states more than others. So in general, adequate amounts, the nutrients I talked about before, many of them have roles to play in these enzymes as well. And some of the big ones are going to be selenium, zinc, copper, pyridoxal 5-phosphate, and folate. But there are a couple of non-essential nutrients that have been shown to be helpful for the deiodinase enzymes. And these are bonus items that go along the ways of helping your thyroid work that much better and helping your body optimize your levels that much further. So one is called trans-resveratrol. Not the same thing as common resveratrol, but this has been shown to help the thyroid cells better respond to TSH and also help them absorb the right amount of iodine, but not too much. For these purposes, small amounts are really useful. 10 milligrams is a good day. A good day is a good dose for a day. Huge amounts of resveratrol, ironically, might make the body less able to stop premature cancer cells. Those are doses that are well over 500 or 1,000 milligrams per day, and that's why there have been concerns stated about high-dose resveratrol supplementation. But 10 milligrams is more akin to the amounts we would get in foods like grapes, grape seeds. Next up would be broccoli sprout extract. This has been shown to help your cells' response to TSH and also to diminish the thyroid antibodies. So when TSH is there, your cells have to hear it and have to be activated by it. And we've seen from clinical trials that broccoli sprout extracts help your cells respond better to TSH. And this is kind of funny because people have been concerned about, goitrogens in broccoli and cruciferous vegetables. And yeah, they're just really not relevant today here in the modern world. Not only that, many of these things are actually good for you. So yeah, broccoli sprout extract, positive effects, making your body respond better to the same level of TSH. This is something else to where you don't need huge amounts. A good dose for an adult with thyroid disease, about 75 milligrams per day. And last up I'll talk about in this context will be quercetin. This one really targets the D1 deiodinase enzyme. This has also been shown to help the thyroid be more resistant against the harm of excessive amounts of iodine. And supplemental quercetin, 50 milligrams a day, can make some really good differences. So those are the things that I do recommend. There's been a lot of other items recommended for thyroid supplementation. That can include animal extracts like bone broth, or various herbal medicines like coleus for scoliae or ashwagandha. Sea vegetables are often talked about, like kelp or wakame or dulse. We hear recommendations for essential oils like frankincense or lavender, various probiotics, non-essential amino acids, fungi, inorganic mineral blends. There's one called shilajit or various colloidal minerals. So are these things helpful? Well, no. Many of those things are actually just out and out counterproductive, and some are harmless, but they're not things that are essential for daily thyroid function. So I wouldn't include those in your routine supplementation. They just get to be too much. You might not end up doing what is helpful, and things in combinations work different than things do individually. So I wouldn't add those in. There has been talk about vitamins being fermented, whether or not they should be. And fermentation is an idea that's in foods. There are some positive aspects to fermented foods. They can be useful for your gut flora, but vitamins themselves are vitamins and minerals especially, they're pretty base compounds. So when you ferment something, you chemically change it. If you were to chemically change a vitamin, it would no longer be a vitamin. And you can't chemically change a mineral. Minerals are elements. They can't be physically reduced. They can only be changed by a particle accelerator or some pretty advanced stuff in a physics lab. But yeah, we can't change them. They don't change by fermentation. So don't consider that an important step. So here's a few thoughts too. Then there's the idea about, too much of a good thing. What if you get too much? And that's the big consideration. Nutrients are all helpful in those ranges, but above those ranges, they start to become less effective. They block what they could do and what could be helpful. So vitamin A, way above 1,000. Same thing for vitamin C, above 1,000 milligrams. Vitamin D is more individualized. We think more about per blood levels. Vitamin E, I wouldn't exceed 300 units daily. There's actually a full table. Most of the B vitamins, I wouldn't go above 25 milligrams daily for many of them. Exceptions could be niacin. B12 is in different units, so that's micrograms. But yeah, take a peek at that table for ideas on what your maximal daily amounts would be before you're getting excess. And then with logistics, how do you actually go about doing this and how do you set it up? Multis make a whole lot of sense. The drawback is that when you're taking pills, you've got the active ingredients, but you've got a lot of inactive ingredients. And many of them are things that you wouldn't really find in food. And in general, the inactive ingredients are not a big deal in a pill or a couple pills or a few pills, but in 20, 30 pills, they might become a big deal. They can act up, they can become gastrointestinal irritants, they can change how the nutrients work. Other advantages for a multi, they're so much more cost effective. And again, you've got a lot fewer pills, you've got fewer bottles to open and close, fewer things to take with you, and just a lot more simplicity. So that's the perk about them. I put together a comparison chart and made a table. So really the ways to get the things you want in the right amounts, there's three big options. So one of which is to just buy each individual bottle of the particular nutrient that you would need. The other one is to get an iodine and folic acid free multivitamin, and then fill in the gaps for whatever else that is missing to get to this target of these 24 nutrients. And then the simplest one is just take a daily reset pack. In terms of cost effectiveness, taking the individual items separately, even getting the cheapest ones you could find on Amazon, it's about $180 for a month's supply. If you're doing a multivitamin that's iodine and folic acid free, that's not the Daily Reset Pack, you've got a lot of things to fill in to make up for that difference. By the time you fill in for all the odds and ends, it's going to be at least about $138. And then the pill count. So taking them separately, you're looking at 24 pills per day for individual ones, or with the non-Reset Pack multi, at least about 16 pills per day. So the Reset Pack, 8 pills per day, $99 per month, so super cost effective. But definitely know that with multis, you want to avoid iodine, you want to avoid folic acid. You don't want to get a high dose of B vitamins, you don't want to get a high dose of vitamin A, you want to avoid insoluble calcium. Now, iron is important. I didn't talk about iron here, I've trained on that elsewhere. You don't want that part of your multivitamin. The reasons for that are twofold. One of which is you might not need iron. Many people just don't. The other one is that it doesn't play nicely with others. When you jam it in a capsule with other vitamins, the other nutrients may not absorb or they might get inactivated. So your antioxidants, for example, can be broken down. And your trace minerals like selenium or copper or zinc, they won't absorb well when they're mixed with iron. So you don't want iron in the multivitamin. And again, you don't want those whopping B vitamin doses because that can be a factor for causing liver harm. And we now know that 20% of the time when someone goes to the emergency room with acute liver damage, it's because they've taken too many vitamins. There's just too much in a lot of common things. So yeah, so easy opportunity. Getting these 24 nutrients, you can see more stable thyroid levels. You can see it easier to regulate your thyroid gland. And then your gland can get better and stronger. Energy can pick up, hair, skin, nails, mood, memory. They've all been shown to improve with the right micronutrients. And not only can your body just make thyroid better, but when you're taking it, you'll respond to it more effectively. Your levels won't shoot up and down. You'll be lower in side effects. So it's important to eat well. I've talked tons about that before, and I will talk more about that in the future. But regardless of being deficient, some micronutrients can be good for your thyroid. Those are the big ones, and those are the good amounts. So, all right, take great care, and I'll see you again real soon. Bye-bye.